Physician's assistants, or PAs, are important members of the healthcare team. Not only do they diagnose and treat patients, they also counsel patients on preventive care, prescribe medications, and in collaboration with physicians, perform other important patient care activities. On this week's Health Talk, the director of the Norwalk Hospital PA Surgical Residency Program will join me to discuss the role of the PA in healthcare today. So stay tuned, we're up next. Hi, today the topic is the role of the physician assistant. I'm Dr. Eric Mazer. Joining me is Richard Cassa. He's director of the Norwalk Hospital Physician Assistant Surgical Residency Program. Thank you for joining me, Richard. Hi. Welcome to Norwalk. I know you're a relatively new arrival, taking over the surgical PA residency.
It's a big title. A lot of words, a lot of syllables.
And let's try to, as they say, unpack that.
Sure.
So PA. PA, we were talking before the show, is probably one of the fastest growing, if not the fastest growing job in medicine. Yet I suspect a lot of our viewers really don't know what a PA is. So tell us, what is a PA?
It's actually a very hot profession right now. Just to kind of give you a little bit of history, it's a relatively young profession, about 50 years old, and it was developed in the late 1960s at Duke, where a physician, Dr. Steed, noticed there was going to be a shortage in primary care physicians, and he utilized Navy corpsmen that had extensive military training and developed a program for them to send them out into the healthcare workforce. So,
I didn't know that. That's really fascinating. Yeah, so he's taking the medics from military training and giving them a role in the civilian world.
Exactly. And fast forward 50 years later, there's 131,000 PAs in the workforce that see about 400 million visits per year in the country. So it's an exciting time to be a PA.
So a physician's assistant, that presupposes you work with physicians closely.
We do.
And I think I'd say as a physician, we complement each other. That we,
exactly.
This is not a ruler-servant role. Mm-hmm. It's real collaboration. But you actually have to be trained to be a PA and be licensed to be a PA.
Correct.
So why don't you take us through some of that? How do you get to be a PA?
So it's actually, I've been a PA for 18 years, and the process has become increasingly competitive over that time. I'm not sure I could get into PA school anymore, but typically an ideal candidate for PA school will have gone to undergraduate school, gotten some type of degree, some type of bachelor's degree, maybe even another degree at some point, and they usually have about 3,000 hours of some type of patient contact to be competitive to apply. And then they'll apply to a program. And then,
how do they get 3,000 hours of patient contact
most of these
without being in healthcare?
Most of them get another job. So they might be an EMT, maybe they work as a nurse's aide, firefighters. These are just kind of athletic trainers. Mm-hmm. So they may have, for a lot of PAs, this is an alternate career for them.
So this is actually a required prerequisite for most people who go into the PA world?
For most programs now, you have to have a few thousand hours.
For medical school, they don't really look for that kind of training. They like us to have evidenced interest in patient care activities, but 3,000 hours is a lot of time.
Yeah, and that's an estimate across the spectrum, but it's for the very competitive schools, that's what you have to bring to your what you have to bring to the table to make it in.
So this is you've finished your undergraduate training, you've had some extensive experience in some patient contact, and then what are you admitted for? A PA degree? How does it work out?
So at this point, it's a master's degree.
How many years?
It's a master's degree, and it takes about, once again, programs vary, but about 27 months or so. So it's about 2 years, but it's an intensive training. PAs, we cover all aspects of medicine, so we get education in dermatology, primary care, pediatrics, surgery, a whole slew of generalist type categories. And then we'll spend about 2,000 hours in school doing clinical rotations where we get our hands-on training. Mm-hmm. And then once you do all that, we'll sit for our board exam, and I believe it's about a 5-hour exam now that you have to pass in order to practice.
Now, that sounds very similar to a medical education, except that it's shorter. So exactly. I guess one of the questions, I went to medical school for 4 years. Mm-hmm. The first 2 years we took what we called our basic science courses, which were anatomy, physiology, pathology, et cetera, et cetera. And then the last 2 years, we sort of learned had the clinical experience. Sure. I mean, how do you compress that what does PA eliminate to get down to those 2 years from the 4 years that I just described?
Sometimes it doesn't
feel
like
go faster.
I think it does go faster. It's longer days, I think, and I'm not by any means putting down the physicians and their education. A lot of it is compressed. I'm sure there is some of the nitty-gritty details may not be as important for a PA as it would be for a physician, but we also don't do as much as a physician. You know, a physician can go into an operating room, they can operate. While we can do that, we can assist in the operating room, but we're not the ones performing surgery. So those are probably some of the ways. Whereas a physician's going to spend many years, 4 years in medical school plus a residency of additional training and maybe even a fellowship, which is even more training. So we kind of condense all of that, and then we do a lot of our specializing while we're working.
No, that is a very big difference in that the physician, I mean, I went to medical school and then spent an additional 6 years training in internal medicine and hematology oncology, so it was a total of 10 years from the day I started till I got a real job. And you're able to compress that, but you said you get a lot of that experience. Well, firstly, it sounds like you get a lot of experience before you even get into PA school in terms of interacting with patients, knowing that you like that interaction. And then afterwards, you get a de facto specialization based upon what environment you're working in. But let me ask you a question. Now, you're also head of the Norwalk Hospital PA surgical residency.
Exactly.
So it's a one-year program, I'm aware of that. That is giving you some specialization. Do all PAs do a residency?
They do not.
And so tell us a little bit about the residency and how that fits into the story of a PA.
So not all PAs do a residency. They don't have to. It's not required. But some people that want to get additional training in something can do it. So in our case, we have a general surgery residency program. There's emergency medicine residencies, cardiothoracic surgery, heart surgery, all of these things. So we try and provide. It's almost like I call an extra year of almost, I don't want to say hand-holding, but additional resources that are guaranteed to help strengthen our physician assistants. So
I would think it would also make the transition to real clinical practice a lot easier for those. If someone has a surgical residency, I would think they would be much more desirable than for a physician or for a system to hire them, because they don't have to be trained on the job.
Exactly.
So it puts them in a good
and a lot of jobs, if you look at a lot of job descriptions, they all ask for at least 1 year or 2 years of job experience. So one of the things that we do, we can provide that for people going out into the real world. In a lot of PA programs, you get just a little snippet of surgery. So typically, most programs like general surgery, for example, is about 1 month. So you spend 4 weeks, maybe working 60, 80 hours a week during that time, but you'll get 1 month. Here we'll give you another 12 months of general surgery, and we have different types of rotations that the PAs can kind of test the waters in and see what they like and what they don't like. And then while they're doing that, we also give them classroom time. We make sure they have dedicated lectures. We make sure they're in the simulation center practicing, all sorts of procedures and techniques as well, so that when they are taking care of patients, that they can take better care of them. So
let's go back to the patient's perspective. Patients. Well, we said at the beginning that the PA profession is exploding. Tell us a little bit about the roles that they're serving, PAs are serving in our new healthcare system.
Sure.
And also, when are patients likely to encounter PAs?
They're probably likely to encounter a PA all the time. For example, at Norwalk Hospital, if you're coming to have surgery at Norwalk Hospital, you will encounter a PA. There are no surgical MD residents who are training. We have staff, physician assistants this is their job, this is what they come to do every day, and then you'll see our residents will be there as well, working alongside the medical surgeons. But you can find PAs in any aspect of healthcare. You'll find them when you go to your doctor's office. You'll find them in the hospital. You can find them doing research. You can find them in all the armed services.
So if I go to my doctor's office for a routine check, or let's say for a preoperative evaluation, should it matter whether I see a PA or the doctor?
No, it shouldn't matter. They're highly trained, and the nice thing about being a PA is we have a strong collaboration with physicians, and there's a lot of dialogue that goes back and forth, and it's truly a team dynamic. So I think it's a comfort level between the physician and the physician assistant.
And I was going to get to that. I think it's representing a new paradigm in healthcare. The old paradigm was, I don't know, you're probably too young to remember Dr. Welby, Dr. Marcus Welby, but it was a TV show. And he did everything. He did counseling, he did home visits, he did surgery. He was the master of everything. And in today's world where there's a demand for healthcare services is growing and growing and growing, and there's only a limited amount of resources to pay for that, we've got to extend that.
Right.
And I think one of the wonderful things about PAs is an experienced PA in a setting, it not only can be every bit as good as any doctor, but can be better in certain ways because you can slice off an area that you become so good at.
Yeah, we like to think that when my last job, I worked in a neuro ICU, so I dealt with a lot of patients that had.
And that's a great example. There are I doubt there are too many physicians that work just in neuro ICUs. They work in neuro, but they also do neurosurgery and they do critical care and
there's a lot of even medical residents that they just may not be interested in doing something like that. So it's great to have clinicians that want to be there. They want to take care of these types of patients, and we practice at a very high level of care because the physicians that we worked with, we worked very closely with.
And that's the other point.
Daily.
I think, but this is true for physicians as well as PAs. Professionally, we need to know where our limits are.
Sure.
There isn't a physician alive who can practice every aspect of medicine in a quality way. That's why we have specialists. That's why we call on our colleagues to help out. And in a way, this is not all that different. It's just the PA is often more of the frontline staff.
Yep. Yeah, and sometimes as a PA, it's okay to say, I don't know, I'm not sure about this.
As a physician, you should be able to say that too.
And pick up the phone and call someone who does. Like I said, in my last job, I took care of neuro ICU patients.
Who are very complex patients.
Very complex, and it was usually myself in the ICU at night, and if I had an issue, I had to pick up a phone and call one of my physician colleagues. So they were relying on me to discuss patient exams, give them updates on test results, radiological exams, things like that.
And I will say, I know we use medical trainees or surgical trainees in some of the same places. I'd much rather have an experienced PA caring for me in the neuro ICU than I would a first-year surgical resident.
Sure, I hope so.
That's not to say anything negative about a surgical resident.
No.
It's just to say that you do have that level of experience and in-depth knowledge of that slice of healthcare that makes you extraordinarily valuable.
Yeah, exactly. And it's like saying I would expect that an endocrinologist should have more knowledge of that type of medicine than I do, because that's not what I specialize in, and that's okay.
And I think in certain ways you also may have more time to interact with the patients. So I think that's really valuable for patients. We've run out of time. I can't believe it. We just got started.
Fast.
But this is the coming wave of medicine, this partnership among physicians and I don't know, mid-level practitioners. I don't quite like that term, but the PAs, nurse practitioners, nurses. We are a team caring for patients, and I think as a team we can do better than any one of us could be alone.
Absolutely.
And it's sort of, I want to say welcome to the profession. It sounds patronizing, but I'm so thrilled to see this evolution of the profession.
That's great.
Thank you very much, Richard.
Thanks for
really
your time.
Appreciate it. Unfortunately, we have run out of time. I want to thank my guest today, Richard Cassa, for joining me on Health Talk, and thank you for watching. We'd love to hear from you, so remember to share your questions and your comments. Please share your comments by calling us at Community Relations. We're at Nuvance Health at 203-852-2250. We'll see you next time.
Well, Thomas, you've got prediabetes. But with more exercise and a change in diet, it can be reversed.
I've tried exercising. It just makes me hungry for bacon.
I love bacon, too. And who really likes to exercise?
Not me.
Me neither.
Nobody. So we're good?
What? Oh, you still have prediabetes. Big time.
Physician's assistants, or PAs, provide care in a variety of settings, from primary care practice to complex hospital-based surgical procedures. On this week's Health Talk, Norwalk Hospital's Director of Physician Assistant Surgical Program will tell us why he chose this career path, one of the fastest growing in the United States. So stay tuned for an interesting segment. We're up next. Hello, I'm Dr. Eric Mazer. Today we're going to discuss the role of the physician assistant in healthcare. Our guest is Richard Cassa. Richard is the director of the Norwalk Hospital Physician Assistant Surgical Residency Program. Richard, thanks for joining us.
Thanks for having me.
So you're a PA.
Correct.
Maybe you could take just a few moments and tell our audience, what does it take to become a PA? And then I'd be really interested in why you chose to get there. But
sure. What
does it take to get to be a PA?
So the short version is you have to have usually an undergraduate degree, so a 4-year degree, an undergraduate degree, and then most PA programs now, because it's become so competitive, want you to have at least 2,000 hours of direct patient contact. It's not necessarily a requirement for all the programs, but
that's a considerable amount of time. How do people get that patient contact before their PA school?
So a lot of people, maybe they had another career, or they know that they wanted to be PA, so they had to do a little intermediary, a side step to get there. So they might have been an EMT, a paramedic, athletic trainers, nurses' aides.
They can volunteer in an emergency room or something like that.
Yeah, exactly.
Okay.
So once they kind of get those hours, they have to also make sure in their undergraduate work that they have their anatomy, their chemistry, their biology, a certain, each program.
Pre-med type courses.
Exactly, a lot of pre-med courses. But once again, a little variety depending on the program. And then once you get into PA school, it's about 2 years.
PA schools, I know Yale was one of the early PA schools.
Sure.
Are they all sponsored by universities, or are there some standalone PA schools?
I'm not 100% sure. Most of them are affiliated with a university, maybe a big like Yale, it's affiliated with the School of Medicine, so it's a much larger institution. But you also have much smaller programs out there. Connecticut happens to have 5 programs.
Really?
So it's actually that's a fair amount of programs for a state this size. But there's about 238 programs in the country.
Wow, that's become. And it's also one of the fastest growing professions. So you were saying, so you get your undergraduate degree. You have to have some patient encounter experience, and then it's a competitive process to get into a PA school.
Sure, you have to have certain GPA, obviously interview, references, all kind of stuff that you would need to get into school again. And then you'll go through a curriculum that's an intensive 2-year training, so you're going to have a section of your time where you're in the classroom and you're studying your anatomy, your physiology, maybe you have a cadaver lab where you're dissecting patients. And
now we were talking earlier, it sounds identical to a medical school curriculum, except that medical school is generally 4 years and PA school is generally 2 years.
Yep.
So what do you skip? or do you just run twice as fast?
I feel like you run. I feel like you run twice as fast. I'm sure this. I don't want to say for 100% certain, but I know that I felt like when I was in PA school, some of the stuff that we would skip over versus the MDs were more of the maybe the stuff at the microscopic level. But we still have pathology and microbiology and
I
that
think
kind of
medical
stuff.
school, I know, is also preparing people to be clinical researchers and basic scientists, and PA is really a clinically oriented experience and outcome.
Yep, you'll find a PA in an office. You'll find them in a hospital. You'll find them, in the operating room at the hospital. It's not uncommon for a physician and a physician assistant to work together in a surgery. You'll find them in the armed services. I actually, over the summer, had a ladder kind of fall on my finger. I had to go to urgent care, and there was a physician assistant in the office. There was no MD in the office at the time. She was able to. I got my tetanus shot. She took some X-rays, sutured up my finger, and sent me home.
Yeah, and I had a pre-op last year, and it was done by a PA, and I was perfectly happy. PA did a great job. I was perfectly happy. Even sitting here as a doctor, watching the person doing my own exam, I was very pleased with what they did.
And we like to think that we provide a very high level of care. And we can do a lot of, bread and butter healthcare stuff that can help free up time for physicians to maybe work on something that's more complex, or just, help us get patients, in the office sooner.
So this is a way really that we've been able to extend medical expertise among more people so that we can provide more more services for hopefully not a great more resources, because I know that there isn't infinite time, physician time, there isn't infinite PA time.
Sure.
But this is a way of getting more resources out to people.
Yep.
Why did you getting down to, obviously a very bright guy, you could have gone to medical school if you wanted to. Why did you become a PA?
I knew I wanted to go into healthcare. I was in college. I became a volunteer EMT. I did a little firefighter stuff on the side. Didn't tell my parents about it until later on. But
the EMT part or the firefighting part?
The firefighter part. My parents didn't love that part
that's
at
what
all.
you were referring to.
I loved being an EMT, but I saw definitely some struggles with the people that I knew that did it for a living. It wasn't uncommon to see some of them working 2 or even 3 full-time jobs just to kind of, to pay their bills. And while I don't mind working hard, I wasn't sure that's exactly what I wanted to do. And my sister, who at the time is an occupational therapist, introduced me to a colleague of hers that was a PA, an orthopedic surgery PA. And I spent a day with him, and I saw what he did, and I couldn't figure out the difference between what he did and what a physician did. And I just asked myself, why would I want to go through 4 years of medical school, the additional training that could be 3 to 7 years on top of it, have all of the debt from medical school. And I just said, it doesn't make sense to me. And I said, I think I can be a PA and really provide and take care of patients in the way that I want to, that I find meaningful, and maybe not have the burden of having to sacrifice my personal life for my career.
Yeah, and I think we're seeing among physicians some of the same changing expectations that their career. I think fewer and fewer young people are willing to sacrifice their life for their career in this generation than in past generations, which I think is probably a good change, because I think a whole human being is probably a better doctor and a better PA.
Yeah, it's tough to, I have a lot of colleagues that are physicians, and they don't get their first job, as a physician until they're in their late 20s, early 30s.
33.
And and a lot of their friends have they're already, they've had jobs for years. They maybe have families, and I'm not saying physicians can't have families in the residencies. It's just much harder when you're working 80 hours a week. You could work a full month of nights, and you kind of just drop off the planet.
And how are you finding? I mean, you've been a PA now for 18 years. How do you like it?
I love it. It's a great job, and one of the best parts about being a PA is you don't have to do what you do forever. So if you do dermatology for 5 years and you say, you know what, I don't want to do dermatology anymore, I want to do primary care, you can do that, whereas a physician doesn't have as much of that flexibility.
Yeah. Because PA, we didn't say this, but the PA training in the specialties is largely on the job.
It is to some extent, and I think we pack in a lot of those clinical hours in school, and then we offer our own residency programs that help get that training. But yeah, a lot of it is you and I working together, and a physician just training me, saying this is how I like this to be done, and working together and developing a very cohesive relationship.
And are PA hours more circumscribed? Do you take call the way a physician will take call every other night or every third night?
I think it's changed. I think when I first started 18 years ago, a Monday through Friday job was the norm. But I think with restrictions on how many hours a physician resident can work, and just where there's gaps in healthcare, you'll see PAs now taking call, working overnights, working holidays, days. All of these things are fair game.
Mm-hmm. Well, I think that, as a physician, I think that was some of the hardest things particularly as a resident. But as a resident, there were times when I would work every day and every other night for a month. Mm-hmm. That was pretty brutal, and it's not allowed anymore. We know that wasn't good for either the resident or their patients, but that was the gauntlet you had to run to become it's my impression that PAs, if you're scheduled for a weekend, you're going to have some compensatory time off, so that there's some, and I think that's happening more among doctors too, that the expectations of the 90-hour weeks are going away.
Yep. My previous job, I worked 3 12-hour shifts usually in a row, and that was it for the week. So I'd work 3 days in a row, and I could have 4 days off. So so you worked hard for 3 days and left early, came home late, but
you
then
got a good night's sleep.
yeah, I slept very well, and then but then I had 4 days off, and it's great to. You can get a lot done on a weekday. There's not too many people in the grocery store at 10 o'clock in the morning
I've
on a
learned that
Tuesday.
since I retired.
Yep. So I used to walk around. It was me and the retired people in the grocery store, in the mall. So it was great. Get twice as much done in half the time. So it was a good lifestyle opportunity. You know, it came with some nights. It came with some weekends. I had to work some holidays, but once again, you could have 6 days off in a row and not have to take a day off from your own, take it out of your own time off bank, which is great.
So there is some real lifestyle considerations as well as growing up faster.
Sure.
You get to go to actually have a job. But I know your wife is an APRN.
Correct.
And that's an advanced practice nurse.
Correct.
And we hear a lot about PAs and APRNs being healthcare extenders, and I think they both are. How do they differ?
The reality is you probably, on the ground level, if you're a patient, you probably wouldn't even notice the differences. Their education's a little different in terms of PAs kind of come from more of a medical education, whereas a nurse practitioner, usually they come from more of a nursing background. And like we said before, PAs, their training is a global picture, so they get a snippet of everything, whereas nurse practitioners, they can focus in on certain things. You can be just a pediatric nurse practitioner, so you just go to school to learn how to take care of children. You can be a family nurse practitioner, where you do learn the gamut from childhood to the geriatric population, or you can be what's called an acute care nurse practitioner. So those are nurse practitioners that work usually in like an ICU type setting. So they have some of their training's more focused, whereas a PA is more generalist, and then you can kind of focus in after.
And one thing that I think may differ, and please correct me because I'm not, but you mentioned that for PA there are in general, several thousand hours, 3,000 hours of clinical experience, really patient face-to-face experience before you get into PA school.
Sure.
Then PA school itself has a certain number of hours of sort of clinical experience. In medicine, we have our clinical rotations and then residencies that we have to do. Do nurse practitioners have, I started to ask you this question before, do nurse practitioners have the same sort of clinical requirements to get that degree? I know they pick it up afterwards, but
a lot of there are some programs that's actually basically an accelerated program where I had a colleague, one of my colleagues was not a nurse, but she became a nurse practitioner and kind of did an accelerated degree. Whereas a lot of nurses, once again, these programs are now so competitive that they have to have some type of clinical hours in order to just be competitive. While it may not be a requirement, but if you want to kind of have a chance to get in, you're going to have to show that you've put some time in at the bedside. I know nurse practitioners, I think they usually have about 1,000 hours of clinical time in their programs versus the PAs, which are a little bit more. But
functionally not that different.
But functionally not that different. And every state's a little different. So a nurse practitioner can actually, in some states, they can open up their own business and they can treat patients and they don't have to work with a physician. Whereas currently, I think about all the states except for North Dakota, a PA is working with a physician, but that seems to be starting to change.
So then we're going to see, we've run out of time, but we're going to see more and more what term do you like? Mid-level practitioners, physician extenders?
I think it's advanced practice providers, advanced practice clinicians.
Okay. We're going to see more and more of you guys.
We're working on the name, yeah.
We're going to see more and more of you guys and your wife guys around, because I think we know that that's where healthcare is going, towards this team approach to healthcare. And unfortunately, we've run out of time. I'm so sorry, because this is such an interesting topic. I want to thank our guest today, Richard Cassa, for joining me on Health Talk, and also thank you for watching. We'd love to hear from you, so remember to share your questions and comments by calling us. Please call us at Community Relations at Nuvance Health, 203-852-2250. We'll see you next time.
Well, Thomas, you've got prediabetes. But with more exercise and a change in diet, it can be reversed.
I've tried exercising. It just makes me hungry for bacon.
I love bacon, too. And who really likes to exercise?
Not me.
Me neither.
Nobody. So we're good?
What? Oh, you still have prediabetes. big time.